So if you think you have an enlarged thyroid gland, or if you have noticed a nodule in the front of your neck, do check out this video. Hello, I'm Dr. Thomas Ho. Today I'll be talking to you about thyroid nodules. Thyroid nodules are abnormal growths within the thyroid gland. Not everybody has them, and it's important to get them sorted out by a doctor or specialist. May not be that obvious to the person having a thyroid nodule initially. The most common cause would be a lump that you can see at the front of your neck when you look in the mirror or when somebody looks at you. Other than that, it may not be obvious, especially if you have a somewhat big neck or the nodule is it's small and not visible. There's a range of symptoms to when one has a thyroid nodule. These symptoms can range from, as I mentioned, a visible lump to a discomfort in the neck that gets worse as it gets bigger. It can also cause pain when that lump occurs quite acutely, like within a day or two. Or it could be part of a generalized enlargement of the gland, such that the patient or the sufferer has a tight feeling around the neck, or may be suffering from symptoms of hyper or hypothyroidism. So firstly, when a patient comes to me with a thyroid nodule, the first thing to do is get a proper history. That basically means asking a whole bunch of questions about when this was first discovered and whether there are any associated symptoms that I mentioned earlier on, such as hyper or hypothyroidism. And then following that, a physical examination is routinely done, and this is to ascertain the size of the nodule, how many nodules there are there associated lymph nodes that may be suggestive of perhaps a cancer, and also to see whether this is large enough to be causing any impending danger to the airway, to the esophagus. And once the physical examination is done, we will then proceed to doing some blood tests. Again, these blood tests are to determine if the patient has excess or deficiency of hormones. We also do some tests to look at whether there's a autoimmune condition, and that's through measuring some antibody levels. And finally, what I do in my practice is to do an ultrasound in my clinic that will give us immediate answers as to the nature of these nodules, how big they are, how many they are, what's the size of the gland, whether there are any suspicious features that may hint towards a cancer. Firstly, thyroid nodules are very common in our population, especially in women. It's been estimated about up to 50% of women do have thyroid nodules, whether they are aware of it or not. Similarly for men, lower percentage, maybe up to about 20-30%. When it comes to the hormone dysfunction, again, that may not be apparent to the patient unless he or she has symptoms of hypo or hypo. These are also quite common in our population. The common causes are, of course, due to autoimmune conditions, whereby there's an inflammation in the thyroid gland resulting in excess hormones being produced or deficient hormones being produced. Aside from that, one could also get an inflammatory condition that occurs out of the blue and would resolve over time with some supporting medications.